Hello, everyone. Good morning, good afternoon, and good evening. Welcome to Live It Up, the show where we explore and discuss how to take your life to that next level and beyond. We cover health, wealth, relationships, and how to create a life that feels good, because that is what we all ultimately want. We want to feel good. I'm your host and coach, Fletcher Ellingson. Amy is out for a few weeks, so today, instead of visiting with Amy, we're going to be having a conversation with Sherry Peterson and Donna Moulton of Rural Resources Community Action. And I'm really looking forward to this conversation because, you know what, there are so many people who have fallen on hard times, and they may be in need of food or shelter or medical care or education, maybe child care or mental health services. There's a whole plethora of reasons why people fall on hard times. And it's awesome to see an organization like this that's there to act. The needs are many, and while it can be easy to throw up our hands and say, what can I do? Or, gosh, sure hope the government does something about that. While it can be easy to do that, a concerned and compassionate group of people have stepped forward and said, we'll take it on. We will take action. And isn't that like incredibly inspiring? I mean, when you see somebody who says, there's a need, let me step in, let me contribute, let me make a difference, let me lend a hand, that inspires me. And you know that when I feel inspired by somebody or something, I like to bring that and share it with you. But before we get to that, I want to remind you that if you have questions you would like us to answer on or off the air, you can email those directly to me at fletcher@fletcherellingson.com. You don't need to suffer and try to figure it out all on your own. As I frequently say on this show, asking for help or assistance or advice, that's a sign of strength. So reach out. There are answers and solutions and ways to get unstuck and move forward powerfully. And that's what we want. We want to move forward powerfully. We want to make progress because progress in any area of life, it feels good. All right, we're not going to answer an email on the show today because I want to give as much time to our guests as possible. So we're going to take a quick break, but stay tuned as we learn more about Rural Resources Community Action. Be right back. Hey everybody, welcome back to Live It Up. So glad you're here, and I'm so glad that you're in this conversation. Today we have on the show Sherry Peterson and Donna Moulton. They are from, I'm going to let you guys say it.
Rural Resources Community Action.
Yeah, I love it, I love it. And before we dive into what that is and what you all do and how you help out, we got to start out with some wins or what's going well in life. So Sherry, give us something that's going well in your life.
Something in my life that I'm really excited about is my parents. My parents are in their mid-80s, and they're aging at home, they're active, they're engaged in their community, and they're just doing awesome. So that's really a happy, feel-good place for me.
Yeah, I can really appreciate that. Time with our parents is it's limited, and so it's a real treasure, right?
Yes.
Yeah.
Well, and we all spread out all over the place. So they're in Colorado, I'm here in Washington, but it's just making time and an opportunity to go and visit them.
I love it. I love it. And Donna, how about you? You had something kind of cool happen recently.
I did. I got married in May, and so that's been a fun journey. My husband is Australian, and so part of what we're doing is doing a lot of traveling and sort of seeing the country, and it provides a lot of balance for me as I'm doing so many great things at Rural Resources, leading a great team of folks that are providing some amazing services throughout the state. So I feel like it's really brought some focus for work-life balance, and so that's going really well. I just got back from Las Vegas at a conference, so I feel like
Nice.
I'm, have all these really great ideas going forward. So just feeling really energized around all of those things right now. It's
I love
a great
it.
place to start from.
Yeah.
Absolutely.
Yeah, and congratulations.
Thank
right?
you very much.
Yeah, you bet. All right, so let's talk a little bit about Rural Resources, for short.
Our RCA
yeah.
works.
So first of all, I know the name says a lot about it, but will one of you take it and explain what it is?
Sure. So Rural Resources is a community action agency. There's about 1,100 community action agencies across the country. Community action agencies were born out of the War on Poverty in 1964, led by Lyndon B. Johnson's initiatives. So as a part of community action in Rural Resources, we serve primarily Ferry Stevens, Pend Oreille, and Lincoln counties with our community services block grants dollars. But Lori, Sherry will talk a little bit about some of the other services that we have. But we have a lot of those programs that came out of that era: Head Start, transportation, low-income heating and energy assistance program, weatherization. We help with homelessness. We have victim services. We provide employment and training, a lot of services to seniors. So we really provide a lot of the services to support households to enhance their self-sufficiency and stability going forward. So primarily, the populations that we work with are folks that have low incomes. So really our charge is to be able to work with the systems that they might need in their household to strengthen the entire household going forward. So
I love it.
a lot of social service agencies really have like one particular service issue that they serve. We're lucky enough to sort of be a one-stop shop in that we're able to address all of those at the same time. So hopefully really increase the functioning or support the increased functioning of a family along all domains, and not just one particular domain that they might need help with or have come into the agency seeking help for.
And I went on the website, and it's like you said, yeah. I mean, you guys are covering a lot of areas of life, right?
Yeah.
Not just one. I mean, there was medical and food and childcare and employment and training, right? I mean, the whole.
All the things.
Yeah, all the things that are needed for life.
Absolutely.
Yeah, so really cool. And did I understand you to say that this came out of the Lyndon Johnson era?
I did.
Oh wow.
Yeah.
So it's been around for.
It's been around for quite a while, yeah. So rural resources, but we weren't there right at 1964. We came on the scene in 1965. So we've been around in that area, and while we're focused specifically with those community services, block grant services over on the eastern side of the state, there's also community action agencies right here in this backyard. So Chelan Douglas Community Action and Okanagan Community Action as well provide those same kinds of services, in these counties in this area as well.
Okay, good. So the impact, it's been significant. So can you share a little bit about the reach that it has today, like as far as how many people are using these resources, and the counties that are directly here in our backyard?
So for community services block grant, I will say, so that those 4 counties specifically that I shared earlier, we serve about 10,000 folks a year through those services.
That's a lot.
It is a lot. And so sometimes whenever we provide a service to, for instance, a Head Start student, we're actually serving the entire family. So the way that the family might enter into our services might be specific to one household member. However, in the process, we serve the entire family.
Interesting.
And so that's sort of our charge in that way. So that's specifically with community services block grant. Sherry can probably speak a little bit better to some of the outreach that we have in our Health Homes program as well, that serves more specifically this part of the state.
And when you say Head Start, do you mean the Head Start education?
Yeah, the early,
Okay.
so readiness for kindergarten. So we serve 3- and 4-year-olds as a part of both Head Start and ECAP, which is a state of Washington program. And so the whole idea of it is to really support not only that preschooler, but also the family to make sure that they are ready for kindergarten. And we know that has so much success for outcomes later in adulthood and that sort of thing. So yeah, that's one of our neat early intervention programs that we provide.
Okay, neat. And I love the thing that I didn't know until you guys just started talking was, yeah, somebody can enter into one of your services, and then they can see like, oh, other things that might be offering, and you can serve them in other ways as well.
Absolutely.
Yeah, really neat.
One of the ways that we work at Rural Resources is with a lot of other partners, and community action really is collaboration, working together with other people to find ways to provide help and assistance. Some of that can come from specific grant funding for certain projects. Some of it can come from fee-for-service programs where we're partnered with, for instance, insurance agencies. And those insurance companies underwrite the costs of the program because they see the value of them being delivered within the population.
Got it. And sometimes it helps when things are diagrammed in my head, so I'm just going to say this out loud, right? So is it kind of like you guys are the resource, meaning like you have access to all these different services, and somebody comes in your door and you just know how to help direct them to where they need to go for it?
So somebody can come in the door and speak to either a community health worker or an integration services personnel or a navigator, and basically share their story. Let somebody know kind of what's happening and what's going on. What we try to do within Rural Resources is find solutions and find alternatives and find answers. So somebody can come in and they might identify that they have a certain need, and we can certainly answer and address that need. But then it might also, in that course of the conversation, you can find that there's other things that are happening and going on with that family. So you can help identify other potential programs that could be supportive or helpful. And the goal with all that is really to help in a more holistic way, kind of address everything that's going on within this individual and their household, and build resiliency and a toolkit of self-sufficiency, so that if there is a crisis or something that comes up, they know who to call, who to connect with, and how to connect to the appropriate kind of support.
I love that, and I got to key in on something you just said. I heard you say one of the goals is to help build resiliency and self-sufficiency. And that's like, what a gift, right? Because when people can learn that skill set, that makes the difference in their life, right? Because we're all going to fall down sometimes, but to be resilient, to be able to get back up, or to have some skill sets of knowing that you have a level of self-sufficiency is a really powerful thing. Would you agree?
Oh, absolutely.
Yeah.
And being confident that if you take your time and go in to see somebody at one of our offices or at another community action office, that you're going to be able to have a conversation where you're safe and protected, it's confidential, and then you're going to get some alternatives. And then it's individually up to you to kind of pick what sounds like it's going to be helpful or what's going to work. But it's really just working on a safe space to come share your story and find out what could be there to help you.
Yeah. Again, I got to pause there, because again, what I heard was you're also a safe place for people to share their story. And that is like so valuable too, right? Because some people just, the experience of being heard, and that's like invaluable. I mean, it's so rare that people feel heard. And so if you're offering that as well, because then it allows people to get what they need to get off their chest, and then they can begin to move forward.
It's interesting that you bring that up specifically, because we have some locations that we, even during COVID, when everything was closing down and people couldn't and had a much harder time connecting to individuals, we bravely opened a service center, not knowing what was going to happen or how that was going to go. And the response was overwhelming. People really did want to come and talk to a person and have that personal connection, have somebody listen to them, understand what's going on, and then be there with them to help out with it. A lot of times when we work with somebody, we can't do everything for them. There's pieces and parts that they need to do as well, but we can definitely be a partner with them and invest with them and be there while they're walking through that process.
Really, yeah, good distinction. We're not doing this for the client 100%. We're helping them go through it, right? And kind of being a guide and doing some hand-holding to get started. Is that accurate?
Yes.
Yeah, and our services are really focused on relationships, right? So, a lot of folks that we see have been really isolated, don't have those kinds of connections, and so building those relationships, in my opinion, is over 50% of the battle, right? So we have those relationships then that build trust, that then help for us to work together with the program participant. There's some advocacy that happens as a part of that as well, where we might know some of those services or resources that are out there a little bit better than the folks that we're working with for the time until they catch on. So we can also assist in doing some of those things. And if we can build strong relationships with the folks with whom we're working, then that whole process just goes a little bit more smoothly. And there's a little bit more buy-in from the folks because there's trust. And it goes both ways, right? We have shared tasks going forward. This life thing is hard. We need to have a little bit of help and assistance along that process. So
yeah,
we're
absolutely
honored to be able to do that.
Absolutely. All right, that's a good place to go to a commercial break. So hey, stay with us. We're going to be right back with more good conversation. Hey everybody, welcome back to Live It Up. So glad you're here. So glad you're in this important conversation. Today we're talking about rural resources, and we are here with Sherry Peterson and Donna Moulton. Thanks again for being here. I love learning all about this stuff. It's so inspiring. So as we talk about the resources that are available to people, what are some of the highly sought after resources that people come to see you about?
Yeah, I would say that primarily our most sought services are our energy assistance, especially from October till about April. Assistance with housing, so not a whole lot of housing stock out there for folks, and or the economic situation, where we'll have folks who are both a two-income family that are working full-time, can't afford some of the rents that are out there, certainly a mortgage, or there's just not availability around that. So one of the things we're doing in Colville is we're building a 72-unit permanent supportive housing project. So we'll have 72 apartments there that we're partnering with Catholic Charities of Eastern Washington. And then Rural Resources will provide the supportive services. So trying to figure out some of those things in the community that we can add. We do a needs assessment in all of our communities to identify what the needs are and the gaps in services in each of the specific communities that we work with. And I think just about all of ours have housing as being as an issue.
Yes.
And we also do transportation. So we're living in a really rural area. It's very difficult if you don't have reliable transportation as a part of your household to get back and forth to different places. So I'd say those are probably our biggest, our most utilized services.
Can you give me an example of what kind of resource would there be for somebody who was in need of transportation?
So they would just call our number, and I'm assuming that in this area there's local providers as well, and let them know what the need is, and then our amazing dispatchers who have amazing organizational skills, then sort of schedule that going forward so that they can have that. You can do it on a weekly basis, every week. Sometimes we do that for dialysis, for instance, for somebody.
And are you saying that you have volunteers to drive the people?
We have both volunteers and staff that do that.
Wow.
So we have some buses, but then we also have volunteers who use their own vehicles that help
kidding.
to transport folks.
That's outstanding.
We've just started a bus service in the Grand Coulee community, which is sort of in the Coulee corridor and up and down, just in that really remote area. But it is running specifically to bring seniors after lunch one day a week down to run errands and do grocery shopping and then take them home. Another day it's focused on just rides to the clinic. And so the schedulers at the clinic were partners with Coulee Medical Center, and so they're aware that we have that transportation available certain days, and so they can schedule outpatient surgeries or medical appointments for individuals who maybe otherwise would have difficulty with that transportation piece.
Wow, what a high level of contribution to the community. That is so cool. And then is building, is that like a regular thing that you see within this organization, or is this like a specialty outside of the box type of happening?
Yeah, so the building itself is sort of a newish thing. One of the unique projects that we have, we're hoping to do a childcare as well, where we will actually do a building. But other than that, we've really sort of acquired properties that have been out there that meet our needs. We recently purchased our nutrition warehouse, which houses all of our commodity foods, and then a property next to it where we can have our weatherization program, where we have all the things that they might need for a job to go and work on a house to weatherize it. And then behind it, we also have an empty shell of a building that we're hoping to do a commercial kitchen for preparing and distributing food from our local farmers as well. So we really try to take a systems approach to everything that we do. We realize that we really can't have a singularly focused intervention, because if we let all the other things that folks might have needs around not be addressed, then any gains they might make in one particular domain won't be realized or be able to sustain. So.
Got it. Very impressive. Sherry, can you share maybe a success story or a typical success story that you've seen?
Well, sure. In our service location that we have in Grand Coulee, that was the one that we started during COVID, and with people coming in, one of the pieces that we did was really get to know the community, look for people that wanted to collaborate in partnerships and spaces where there was maybe little gaps that we could fill in, like that transportation piece. The bus has been utilized recently to, help transport some patients from long-term care. They were gone for a while, and then we helped to get them back home. And it has the capacity to accommodate people ambulatory as well as people in wheelchairs. But often what we see at that location is when people come in, it's sort of just a one-stop shop. They can come in, they can share what's going on, and then we can work on connecting them to a program that might help. One of the ones that gets utilized a lot in our partnership is the Health Home Program. And the Health Home Program is for individuals who are on Medicaid who have chronic health conditions. And usually there's some social determinants that affect their ability to manage those chronic health conditions. So we really work on, are they getting transportation to their medical appointments? Do they need help getting specialty care or setting up those other appointments? Are they getting denied on certain things that they might need, and can we advocate for that for them? But really finding out what the needs are. Maybe it's a housing circumstance. And so at Rural Resources, we have the ability to connect with in-house departments that might be supportive and help with that. Or we can look into the community and find for somebody, help them identify those resources that are in their community and help get them connected to it.
Got it.
So the improvement you see is improved healthcare outcomes, improved self-management of those chronic health diseases, and just quality of life.
Yeah, I mean, that's huge, right?
It
Quality
really
of
is.
life. That's what we're all
Yeah.
after, a certain quality of life. Yeah. So if people want to get in touch with you or they have questions, how do they get in touch with you?
The website would be the great place to go. While we are based in Colville, we do have offices or service locations in about 17 counties in eastern Washington. So if they go to our website and just go to the locations tab, they can go ahead and scroll down to their community, and it'll give them information on how to connect with us directly.
Okay.
There's also a space on the website where they can just contact us and email, or the phone number, give us a call. They'll talk with one of our navigators that can kind of help drive them in the right direction of who they want to connect to.
Mm-hmm. Good. And just so you guys know how I got in contact with you, we were in a little coffee shop charging our car at somewhere around Cooley or Grand Cooley, I can't remember, but there's a little side of the road place, and there was just some Iraq cards there. And I picked one up and I was reading it and I was like, wow, this is really cool. I mean, this is some good stuff. So that's how so whoever placed those cards there, they got seen.
We got to get some more of those out there.
Yeah, so really good. Also, this brings up we have time to talk about this. It brings up the conversation about funding, like where does the money come from? And is it relied on grants, donations? Talk to that a bit.
I think the majority of the programs that we've had since we've been around are federal funding. So some of that is straight from the Fed, some of it is passed through the state. So we do receive a lot of grant funding. We also do have some fee-for-service programs, and that's primarily what Sherry's working with, which also allows us the ability to look at what other services or what other needs we have in communities that aren't being addressed by a fund, and be able to address those in a little bit of a different way, where we don't have a funder telling us what the outcomes need to be or what the expectation is for our service delivery. But Sherry can probably talk a little bit more about some of the fee-for-service.
So in fee-for-service programs, we work with specific insurance companies. And then those providers help underwrite the cost of the program.
Okay.
We're reporting back to them a little bit about that these engagements happened, and then what those outcomes are. And I think that's an important piece. All of the work that we're doing, whether it's those federal block grants or whether it's work that's coming from a fee-for-service or a grant that we've written to appeal to, to somebody privately that's going to help out, having outcomes is essential. We're not going to continue to get funding if we're not doing what we're doing and doing it well.
Yeah.
So really, looking at how we're making an impact and how those dollars are, being spent, being responsible with that piece of it, and also looking for the spaces where we can really collectively have a larger impact, and that comes back to looking at those community needs assessments to figuring out what's needed in the area. When we move into a new area, one of the other things that we do is really connect with that community. Get a feel for what's happening and what's going on and what people feel is successful and where there's room for improvement. And then figuring out, we don't need to reinvent the whole wheel. We can just figure out what doesn't work from here to here, we can just figure out something that can fill that gap.
Yeah, very pragmatic, right? Yeah,
Yes.
Really good. I just am very encouraged by this. Thanks for all that you do. We're out of time. We're over time, so I'm going to wrap this up. Thanks so much again for being here, And now it's time for you to get out there, be a source of kindness, be a source of contribution. You do have something to offer, and I believe in you.